So this is a reopening overview, which will touch upon our 3.5-month operations of how we intend to reopen the school in the academic 2020-21. We've worked for the better part of 3.5 months in doing and preparing and it's really been the hard work of a team of people that I will present to you. So let me present the crisis management team. And by the way, this is a team that we've had in place even before pandemic times. It's there to guard the health and safety of every member of the community, but especially important during these pandemic times. It's made up of myself as the director of division principals, the assistant principal in the secondary, the HR and facilities manager, the head of security, our head school nurse, the head IT guy, the coordinators for communications and alumni, student support services, the activities coordinator and athletics director, and a representative from the US Embassy. So the reopening plan was always envisioned to help us open the school from the get-go. But we understand as the situation is ever changing and fluid that we will not always be able to predict everything. So really it addresses the first couple of months of reopening. And please note it will be an evolving document as we get new information and the situation on the ground changes. There's many views on how we tackle COVID-19, but we will always intend to be conservative, looking at evidence-based health and safety measures very seriously. We use trusted sources of information, primarily the World Health Organization and the Center for Disease Control, but we also look at recommendations by the government, the Ministry of Health and Education on school reopening. All these policies are subject to change as the situation changes, but our goal is always to meet minimum prerequisites and, for the most part, exceed them. So, given the current state of affairs, we feel we're ready to reopen the school. But here's the disclaimer. That reopening doesn't necessarily mean that it's a face-to-face on-campus reopening. It means that we're ready to work under all three scenarios that I will just present shortly. It means that we're ready to open in a normal case scenario, in a blended, and also in a virtual or distance learning scenario. Because this pandemic continues to be a reality, we must remain agile and flexible and adjust as necessary to preserve our community. And this I have to read as it's very important. All policies put in place will only be as effective as our willingness to uphold and follow through on them. We require your understanding and support, as we're all as strong as our weakest link. Should a subset of our community decide not to uphold these expectations, it will only be a matter of time in which we will need to close down our campus again. This is very important as we've tracked and heard stories of behavior of our community members, and we hope that most of them are upholding the expectations of being safe, being conservative, and having the health and safety of their children and themselves in mind. This is a behavior that we will require from every member of our community if we're to function properly and hopefully have the larger portion of our school year on campus. For this matter, we request staff, parents, and students to sign a form in which they will confirm that they looked through the reopening plan, that they will abide by it, respect it, and also what are the sanctions if potentially they are not to do so as well. We have to underscore that respecting these policies at all times is very critical to maintaining a safe and healthy environment at the school. So in terms of assessing risk, where do we stand right now? So we believe in the community there's a trend of growing COVID-19 infections, and I think that's apparent to all. And so this requires that the school moves to a blended learning model for the most part, or this is level 2 or medium risk, with a revised schedule and a more robust health and safety measures in place. So how do we decide this? We pretty much, first of all, see whether we can open, and we've received the government approval, and I will present that to you as well. So that means we are able to open, and then we look at the level of risk. And currently we believe we're at medium risk, or therefore the learning model 2. But it's never simple as that, because we believe the risk assessment for different grade levels is different, and therefore this is why we have made a decision which includes one model for one subset of students and another for the other. So let me just give you a brief overview of Model 2. I think by now you're very familiar, but it's good to have a recap. So at blended learning model, we are open with a reduction in capacity. We have a shortened schedule, and we enforce the implementation of existing safety protocols and the use of personal protection equipment. So the wearing of personal protection equipment is enforced for all, except for our youngest learners. This is ages 3 to 6. I'll speak to this a little bit later. We reduce class sizes, as I said, we shorten the schedule, we limit student interaction across groups, we enhance cleaning procedures with special focus on high traffic areas and high touch services. So now I hope to give the floor just briefly to our EEC, Early Education Center, and ES Elementary School Principal, Stacy, who will just briefly give you an overview of our blended learning schedule and also talk about the distant aspect of the blended learning schedule. Stacy?
Okay, thank you, Ivan, and good evening, everybody. It's great to see you all here tonight. And I first want to say how excited we are to welcome our elementary and EEC children to school on Monday. We are so excited. The teachers are getting their rooms ready. The school, the desks are all spaced, and we have some new things going on. And we just wanted to let you know that we are so excited to begin school on Monday. As Ivan said, you're looking at our blended schedule, and we do have a shortened day, and this is to keep the groups, we're starting out with a shortened day to help keep the groups apart and safe. Our blended aspect is that in the afternoon, there will be classes, small size classes in the afternoon to do more one-on-one and things. But during the school day, we have some teachers who will be working with the children online, the same curriculum as that's going on in the classroom. And so this is something we've been working on this week, and we're very excited about, because initially we thought the distance learners who are at home might only be getting an afternoon class, but now we will be able to do it during the day while the regular classroom is going on. Our distance learners will also be getting a class online with a teacher. Our teachers will also have office hours in the afternoon, so that parents, if you need to meet with a teacher, that will be available. And again, small group work with one-on-one. What I would like to say, I sent out my welcome yesterday, but the first week or so of school will not be focused so much on academics, and you'll hear more about this with the orientation by our elementary teachers tomorrow with you online, but we want to make sure our younger students are aware of our protocols. We're going to practice them, we're going to learn about them and learn about why we're doing them. So we will begin with academics in about 2 weeks. We want to make sure that we have everything, the kids are comfortable and ready to learn. So that's my portion of our schedule. Thank you.
Thank you, Stacy. So now we go to the blended learning schedule for secondary, and I'll also ask Bella to touch upon distance learning, as this is the model under which we will be starting for secondary, which is grade 6 through 12.
Thank you, Ivan, and welcome everyone. We are also super excited to welcome students into secondary, although for the first 2 weeks, we are going to be exploring mostly this through computer screens, which is nothing bad. It's just different. But we are lucky to be building on experiences from spring of 2020, when our school was able to support students through that portion of our virtual school model. I'm gonna ask Ivan to actually go to the next slide first, because blended learning is something we will be working towards. But as you are aware by now, through communication from Ivan and our school, students in secondary, that is 6 through 12, will be starting the academic year remotely. So they will not be physically coming on campus in the blended learning model cohorts. So we are starting on August 31st, but we very much believe that we need introductions. And as Stacy outlined, we need to get comfortable with one another. There's so much new ground to cover. In secondary, we have a new SIS, ALMA, which those of you who remember Plus Portals, we're saying goodbye to Plus Portals and saying hello to ALMA, where you are going to be able to follow and track attendance and schedules and reporting. But we also have a brand new LMS, ManageBack, where you're going to be able to follow unit plans and track information in terms of grades and assessment. So all of that new information needs streamlining and needs a degree of comfort. So we're going to be using the first 3 days of our first week to at least attempt to bring in small groups in a very safe way our different 6 through 12 cohorts. So that we can explore the outside areas. The weather's nice. There are a lot of changes on our campus to ensure that students have at least an opportunity to see us while wearing masks, but see us a little bit in person as we move through advisory and all of these new systems at play. But then on the 3rd of September, we are going to be starting school in the distance learning model. So on the 31st of August, so that very first week, you as parents will receive, as well as the students themselves, what our schedule will look like. It will be made available to you via ALMA, but it will also be made available to you via the Google site that we are now currently updating on our website, so that all information will be in one-stop shop kind of a space. But what will it look like? We are going to have synchronous learning, which is a little bit different from what we had in spring of 2020. In the high school division in spring of 2020, we tried to ensure that there was synchronous learning, but this time around, we're not closing off a year. We're actually starting a brand new learning experience. We are very much going to have classes Mondays and Tuesdays and Thursdays and Fridays, but we're using Wednesdays as a non-class day. As the slide says, it's reserved for independent research, for study, as well as for something we're calling community building activities, building these communities of interest, as our assistant secondary school principal, Daniel Cunningham, is calling them. So lots of information will be coming your way. We hope that you stay engaged with us. We are definitely going to be sending surveys because we very much believe that we need to have all the feedback in order to ensure making healthy choices. You are also going to receive a spreadsheet with grade level Google Meet links. Should you want to not necessarily join class, but make sure that your child is doing that. So this is how we're starting. And every 2 weeks, CMT will reassess to see whether secondary could move to the blended model. So the blended model allows for time on campus and allows for time on campus. If we can go to that slide, I will just briefly touch upon it. So secondary, as you are maybe aware, is a very big division. And at present, it has the lower end in terms of 6 through 8 and the upper end in terms of 9 through 12. But it does encompass around 600 students. And we want to make sure that when we do go to the blended model, we have opportunities for students to be safe and for classes not to be at full capacity. So if we can go to that slide, it's the preceding one, I believe. Thank you so much. So here in the blended, what we're building towards, we will be dividing 6 through 12 in 2 cohorts. We are tentatively calling them yellow and gray. I hope you don't have issues with those names, but we're just tentatively color coding it. And in this model, we want to ensure that we have enough contact time in the classroom for students to support the full richness of our new MYP curriculum and continue to do so for our DP curriculum. But as you can see, this means groups split in half, so no more than 16 students in a single classroom per class, per period. And it is still an earlier dismissal day, which means 1:30, and they would be done. It does ensure students to have 2 or 3 days on campus, depending on which cohort is following in which week. But I want to highlight that this is something we're building towards. It is not something that we can, at this moment in time, predict that we would be able to go to in the next 2 weeks. So if you are very keen on seeing your children actually have a more face-to-face experience in school, I want to highlight how relevant you are as a partner in building safety and healthy practices and ensuring that your children, our students in secondary, remain safe and healthy. Thank you.
I've just received the message, and I think this is what our IT person also said. Just a reminder that if you're using the browser version, you might just be seeing a face without the presentation. If you're using the actual Zoom app, you should be seeing both. So please have that in mind. If you want to have a full experience for this presentation, you should be using the Zoom app. Thank you, Bella. So our preparations for the start of blended learning are based on 5 pillars: promoting health screening and healthy hygiene practices, adjusting activities and procedures to limit the amount of personal interactions, intensifying cleaning, disinfection, and ventilation of facilities, communicating the safety protocols and procedures with the community, and enforcing and encouraging physical distancing and reducing density. So we're going to focus on each one of them briefly. So as students come on campus, they will of course have to disinfect their shoes and hands. Then they will go through a queue, which would let them acclimatize to the school. And we would actually go through a thermal scanner, which is with very high sensitivity. Both buildings are equipped with such thermal scanners, which allows us to filter more traffic within a shorter period of time. And we would ensure that no temperature is above 37.5. If they are, they would be put to the side and they would be again remeasured. If the temperature reading repeatedly goes up above 37.5, students will be returned back to their parents. In terms of screening, we will require that each student, and this is very important, bring a health booklet, which the school will provide and issue, which has a set of questions that have to be answered on a daily basis. It also includes a measurement of temperature by the parent at home for kids from pre-K3 to grade 5. While we also believe that from grade 6 to 12, some of these questions and the measurement can be done independently. And these set of questions have to be answered with a no. If one of them is answered with a yes, we would have to say that your child should remain behind. So if a child comes with a yes response, that child will be returned back to parents. It is important to note that if you have a yes or multiple yeses, you should also have your child or potentially other affected members remain home, inform the medical nurse, and also very importantly, report to authorities if you suspect that you have COVID-19. The booklets will be issued starting from August 31st. So what we've done is we used to have one space for a medical nurse, and now we've expanded because we realized that there's going to be increased need for health screening and support of our students and staff and our whole community. So what we've done is we've provided nurses' offices in each building, in both the EMS and in the high school building. And we have isolation rooms in both buildings where potential students, staff exposed to COVID-19 would remain until they're picked up or leave campus. To be able to staff these 4 spaces versus 1, we've also brought on 2 additional new certified nurses, Anila Bigorovska and Christine Burns. So now the medical staff team numbers 3, and we believe this should be ample support for the screening purposes that these nurses will have to do. We're very happy, and we realize the importance of PCR testing, especially as we go into the fall season and testing becomes progressively more difficult. We signed a partnership agreement with the Avicenna Laboratory, and so we now have our own testing facility on campus, primarily for the needs of our staff, which will get tested on regular intervals, which usually are breaks or potentially school closure. But what I'm happy to report as well is we will make this testing center available to our parents as well at a reduced cost. So we will provide times in which they can register, and bring their children and themselves to get tested. And the prices are significantly reduced from what you would expect to be paying at a center outside of NOLA. So we believe this will also encourage the regular testing of our community. So what happens when we actually have a COVID-19 case? We have multiple scenarios, and I'm just going to focus just a tiny bit on the last, which is what happens when we have a confirmed case. But please, you're welcome to peruse all 3 or all 4 scenarios because they're all very likely to occur during the school year. So if we have a confirmed case, what we will effectively do is that we will make sure that all students and staff that have come in contact with the affected student or staff are sent home. They're quarantined for 14 days, and then they have to undergo a PCR test to rule out COVID-19. And we realize now there's a gray area of what happens if it's an asymptomatic versus a symptomatic case and so on, and maybe it's 14 versus 10 days. But please mind, we will always opt for the conservative scenario until we potentially switch to a less conservative one. So right now, this remains 14 days and a negative PCR test. All classroom spaces, shared areas, and other possible areas will be thoroughly cleaned. All other students, classmates will have to also self-quarantine for 14 days, undergo a PCR test, and only then will we be able to return on campus. We will do the same for our staff if it's the case that they come in contact with either a colleague or a student. We will also try to contact trace. And what becomes very obvious is that if we have multiple cases, especially throughout the school, it becomes progressively more difficult to track, and we realize that the spread might be wider. This is the time when we actually use our COVID-19 risk assessment matrix to decide how to proceed, and most likely we will be going into school closure and moving the whole school to distance learning. If cases are in the lower school levels, we have effective bubbles there. It'd be easier to isolate particular grade levels, but not necessarily the whole school. Intensifying cleaning, disinfection, and ventilation of facilities. So every room space will be equipped with disinfectants and sprays, and they're replenished on a regular basis. And we've actually purchased several months of in advance quantities just to ensure that there's no shortages in the coming times. We will also use UV lamp disinfection in spaces only during evening hours because they cannot be used when students are around, as they can potentially cause damage to skin and eyes. And they're usually for the more heavy duty cleaning, especially if we know there's an area that's been exposed, and also easier to clean public spaces. We've also placed outdoor wash sinks. So when your children are playing in the playground or outside, they can wash their hands. There's never gonna be a substitute to good hand washing. No disinfectant will do near good of a job. So we wanted to provide more opportunities for cleaning. And I just rushed through the slides. So let's talk about one topic which I think many are very, very passionate about, ventilation. We're now realizing in the 6 months or 7 months from the pandemic that aerosol transmission is a reality. If initially we talked about fomite or surface transmission, that means you touch a surface, a sick person touches a surface, someone immediately afterwards touches it again and gets infected. That was one reality. We also were looking at droplet transmission, which is when we exude bigger droplets over 50 microns and expel them 6 to 12 feet outside of our mouth. But now we're realizing that aerosol transmission plays a big part in the spread of the virus, and we have to be very mindful. So what are we doing about ventilation? First of all, our air conditioning and fan cool units have been thoroughly cleaned. We expect that all classrooms will have to be ventilated after each class. That's why we're providing ample opportunities and breaks throughout the day. Mind you, in 4.5 hours, we have at least 7 breaks to be able to do this. And no class in the early education center and the elementary school will be longer than 40 minutes. And this is 50 minutes in the secondary school. What we will also insist is that air conditioning is only used when a must, but otherwise we're always depending on normal ventilation, which means leaving doors and windows open. We're lucky to also be fortunate to have air purifiers, and we're seeing studies that they play a big role in containing the spread, because good quality air purifiers have a HEPA 12 level filter, and they catch particles as small as 1 micron. That means they catch the aerosols. And if we actually have our air purifiers at a level 3 speed, and yes, they will be a little bit louder. They will recirculate the air 4 to 5 times during an hour, which means within the 15 minutes, the whole air in the rooms will be filtered, and they will most likely catch most particles in the room. So what we've done is we made sure that every single room on campus, now we purchased more units and we have over 100 around campus, even in public areas, is outfitted with such units. The public spaces have much heavier duty ones. Classrooms have smaller units, and then offices have even smaller units, but which are adequate for the size of the room. We also looked at studies, and there's one from University of Colorado Boulder, which says, let's see how much of a risk ventilation becomes for students in a classroom lecture setting. So we looked at our classroom, which is 50 meters square, and we looked at the maximum number of people, which are 16 students and a staff member. We will never go over that number. And so we then look at the square footage and meters per student and staff, the number of transitions, and the overall incidence of the virus in Macedonia. And we plugged those statistics into the study. And what's important is that this study requires that everyone's wearing a mask that at least provides 50% protection. And when we say 50% protection, we don't mean of an N95 mask. That's the heavy duty one. We mean of a textile mask. So it requires both speaker and students to wear a mask. And if you look at the graph 3, a classroom lecture, a well-ventilated room with one primary speaker, such as a teacher and a group of listeners, has very minimal risk of transmission. So it's very close to zero if we follow these preconditions. So this also is making us hopeful about the chance of aerosol transmission. So thanks to our health and safety, we conducted a room capacity study. We looked at every single room on campus and we thought, what is the optimal capacity? And our litmus test was 1.5 meters distance. We looked at different studies. It was anywhere between 1 meter to 2 meters. 1.5 is a prevalent measure. And so we realized that any room, and we have 3 major layouts, the ECDS and the middle school and high school layout, can have anywhere between 14 and 16 students. And this is what we've done with capacity. And mind you, because of this, we had to split certain grade levels in more groups. And we also have had to wait list students because we couldn't meet the capacity requirements. We also looked at all spaces around campus, and we reduced based on the capacity. So in the EMS Fitness Studio, which is a much larger room, it's 18. In the high school, it's 16. We've done this for every single room. And by the way, if you want to see those capacity requirements, I encourage you to go through the reopening plan. By the way, we will also have on every single room that you go in, there will be a number which states the capacity for that room. And in public places, we will also have clear markings of where students, staff can sit. And we will follow closely those space requirements. So what we've also done is to be able to allow for a little bit more capacity, we put partitions all throughout campus. So in public spaces such as cafeterias, in our offices which are shared, and classrooms with dividers. So we will be providing plexiglass partitions for all of our classes from EC all the way to grade 5. And the question is why up to grade 5? Because this is the groups we will effectively try to keep in a bubble, which means that among other things, they're gonna have their meal, not in the cafeteria, but they're gonna have it in their classroom. And this is where most of the specialties will come to. And as I just previously said, should there be a transmission of infection within these grade levels, it'd be easy for the school to potentially contain. We also realized that there's no substitute to outdoors. We now know that the outdoors, spending time in outdoors reduces the chance of transmission by 30 times. So the more time we can spend outside, the better. So we created 3 covered spaces, and we're looking at potentially of increasing that capacity. But these are spaces that can be used by faculty and staff. And so these are 3 spaces, and we are already making use out of them. A very important aspect is how we come and go. And I will not bother you to detail because you're going to be getting specific information to this aspect. But what's important to note is that we want to make sure that people are not intersecting when they come and go. That means we're going to have staggered times for different divisions. The EEC will be coming from, this is the red arrows, will be coming from one time, one entrance. The grades 2 to 5 will be coming through the blue arrows at different times. Grade 6 and 8 at a different time, a different entrance, and the high school at a different time, a different entrance. And very importantly, when they depart as well, and this is something that we will have to present as well, we're going to be using an app system in which every family will have a 3-digit number. They will present the digit to the security or staff on hand, and they, through an app, will notify the teacher, and that student will be released to them specifically. That means we're going to try to prevent students and parents congregating outside as they wait for their students, or as students wait for their parents. The idea is to limit interaction. We understand that it's not always going to be possible, but we're going to try to do our hardest. So here are the cues that I talked about. And so we want students to take a little bit of time before they come into the building. And this is when the thermal scanners do their best job. And you can also see how we've spaced and we've limited capacity within the auditoriums as well. So those little dots are where students are supposed to sit or stand. So we want to make sure that there's no congregating of students. And so our whole school literally will be plastered with arrows, signs, directing students and staff on appropriate etiquette, protocols, limitations. Recess is another big one. As long as we keep them in the classroom, they're fine. But the moment they go in recess, and sometimes there's going to be overlapping recesses, we want to make sure they're kept in their own bubble. So we've created 10 different spaces. We're opening some new spaces on campus as well. And so each group will have to use that particular space assigned to them, and they will rotate out to a different space. A portion of the playground will be accessible, not all. The soccer pitch, the sports court, the grassy area, and so on. And so they will stick to that area, and then they will move to another area on a different day. And just one suggestion of how an outdoor space will be organized. Another key aspect is how we share things, how we use classroom materials, toys, art supplies, PE equipment, library. And by the way, we're still discussing many aspects of how this is done. For example, for the library, we're just talking about even a different approach now, where librarians come to the classrooms versus the classes come to the library. So what is being said here is also under revision. But the idea is that we limit the amount of sharing as much as possible. And when we do, we thoroughly clean. And the basic principle is what you bring on campus, you take with you, but you also limit the amount. And also what is on campus stays there, so it can be cleaned and then used the next day or the next week. One of the things that we're also trying to do is limit the traffic on campus. So we're creating a new ID system, and your cards together with your health booklets will be issued from August 31st. So each parent, student, faculty, and staff, and we will have cards for visitors as well, will be issued a new card, which is color-coded. And each card based on what community member you belong and to what division you belong will have different permissions. And we've now placed turnstiles on different locations around campus. That means we will be effectively zoning the campus so that parents and staff will have access to different areas depending on their position, their membership to a community, and so on. The idea is that in that way, we are also controlling the flow of traffic. And we're very proud of the system, and I think it will also prevent some of the inflow of traffic inside the school. Having said that, I have to note that parents will not be allowed on campus except if they have a meeting or a very sufficient reason to do so, because we want to limit the number of adults that come on campus. We're also going to limit access to lockers. We're only going to give access to the EEC and ES students under adult supervision, and we're going to limit for secondary school students. So it's very important to note that students should be bringing the minimum amount of things because they're not going to be having a place to leave them. Why no lockers? Because we've now seen in studies that lockers are a place where students congregate, they mix, and they cannot always be supervised. So how are we going to communicate all this? One is we have a COVID-19 resource page, and it's being updated. You can always see the latest reopening plan, the reopening presentation, and anything related both to Macedonia, Europe, and the world. Secondly, so I would encourage you that you bookmark that page and then you track it as time goes by. We will also communicate differently, but if you want to see information without waiting for something to be sent by the school, this is the place to go. We will also be producing training videos. We've already done this for our staff, and you should be seeing one latest by Friday of a video that will explain how your child's day will look when coming on campus. So we will also try to provide visual cues of how we expect behavior to look when coming and going from campus. And we will also be very active communicating through different means. It used to be Portals Plus, now will be Alma, on a regular basis, as you've seen over the summer. And we will be closely tracking our COVID-19 risk assessment matrix to make a decision. Are we in the low, medium, or high risk? So, as I already said, we have already plastered the whole campus with signs about physical distancing. We don't like the word social because we feel that we're only physically distancing students and staff, not socially. Limiting the amount of people that can go into a restroom. Also, limiting the capacity of a particular auditorium. So this is an auditorium that fits almost 120 people. It's now going to be only fitting less than 30. We realize this is a very difficult time. I will be the first one to admit. It's not been easy. It's not the transition that I asked as a leader as well. But at the same time, it is the predicament in which we are. And so we all require support. So we're going to have support for all of our community members in different tiers. One is general support, the other one is specialized, and tier 3 is for individualized, for people that really need the support. Because we realize we're all going through these trials and tribulations. And I've already seen the support for staff. I'm hoping to see this beginning for students, but we're also here for you parents. And so if you have anything to discuss, any worries, concerns, we're here to lend a listening ear, and hopefully the same holds true for you when we are in need of support. We've already talked about the distance learning aspect to blended learning, or the distance learning for the secondary school, and we're very proud of 2 new tools. One is our LMS, as Bella said, or the Learning Management System for grades 6 to 12. I think this is the best IB management system in the world that your kids will have access to, and you will see the improved experience through the distance learning. And we have a new school information system, which will allow you real-time access to your students' attendance. Yes, we will be tracking attendance because we're going to be running distance learning synchronously, and of course, tracking attendance when your kids come to school. It will also be issuing report cards, very important messages, and so on. But if you look at the box, there's one thing we also have to put as a disclaimer. It is very difficult to run both distance and blended at the same time. So there's aspects which might leave some things to be desired. So our hope is that at some point, all of our students actually transition from virtual distance to blended learning model, because it really will be difficult for our teachers to deliver both programs simultaneously. And so in some aspects, I think it will be improved experience. In some, there will be, of course, aspects that you would hope happen, but we're only humans, and of course our teachers as well. And so I think they will make their best effort, but I ask for your understanding as well. And we hope that at some point you reach the decision, if we are running face-to-face education for your children, that you also bring your children to school. Let's look at something very important, because I believe that we have to put this in perspective. We've talked about how bad is the situation in Macedonia. So I think it's time to put a perspective. And by the way, the epidemiological situation played a very important role in the way we decided to reopen the school. So the first one that we've seen used is the daily cases benchmark. And here's some recommendations based on how many daily cases per 100,000 people. Here's how North Macedonia looks right now as of 20th of August. We've not updated with the latest data. And based on it, right now, for example, we are in the yellow. And the yellow, for example, says the following: we should give preference to grades pre-K to 5 for in-person and special education services. Second priority is grade 6 to 8, and so on and so on. So this is one way to look at it. And by the way, I've included the source if you want to read a little bit more into the different benchmarks. Here's one by the New York State Governor's Office, and this is what they're using to decide how to reopen. So it says that daily infection rate, or the positivity rate, has to be below 5% using a 14-day average. And that once it's over 9%, school close, and they open at 5%. So let's look at our graph and line. This is the positivity rate. We were as high as 12% around mid-July, and we now have a decreasing rate, although at a slow pace, and we're around 8%. So it's a positive trend, but based on this statistics, for example, a school in Europe would not open. Another one we've seen used is the cumulative daily rate. And pretty much it says that if we have 75 confirmed cases per 100,000 people, cumulatively over 7 days, and a test positivity rate below 5%, we should open. Now, the disclaimer is that we're not fully satisfying that requirement. Right now, we're at 8%, and we just decreased maybe to 7% positivity rate. But if we assume that we've met the first precondition, and we look at our condition, we currently have 50 confirmed cases per 100,000, or that means for every 2,000 inhabitants in Macedonia, 1 is potentially infected. So let's extrapolate that to a school. If we were to bring everyone on campus, we roughly estimate that would be 1,000 staff and students. Statistically speaking, there's a 50% chance that at least 1 person would be ill coming on campus. So if, let's say, we decrease that and we only allow our EC and ES students to come, we just reduce that likelihood probability to 1/10 or 10%. And this is, by the way, provided by New York Times, and so you also have access to the actual study. Another one is a new cases per 100,000 benchmark. And it looks at how many new cases we have on a 14-day moving average. And so you can see that we've sort of been in a narrow band peg between 6 and 8, and right now we're just a little bit above 6. So if we are where we are, you can see that it recommends that if you have fewer than 5 cases, it's grade 6 to 8, and actually I've highlighted, but it shouldn't be highlighted because if it's fewer than 7, we should be opening up no more than grade 3 to 5, because this is where we currently stand. So let's look at our current situation as of the 23rd of August. This information was just issued, and you can access it at the Institute for Public Health. So in the last week, and unfortunately I don't have the graph for it, we've had 840 cases, which is, by the way, not an increase, but a decrease of 7%. And we currently have, out of those, for the last week, we have 281 cases in Skopje, which is 1/3 of all cases. As of the 23rd, that has to be changed. We have a total of 13,000 cases, or 660 per 100,000. And I'll tell you why this is important, because now I will illustrate how other countries are opening and what their epidemiological situation is. So can I you mute the microphone, as I'm hearing some background noise. So how many of overall cases are within the 0, 9, and 10 and 19? So as you can see, in the 0 and 9, there's 3.5% of overall cases, and in the 10 to 19, 4.5. So they are still relatively less affected than the remainder of the age groups. But yes, students still tend to get sick. Skopje has roughly less than half of the cases, or around 922 per 100,000 inhabitants, and it's ranked 4th as the most affected cities in Macedonia. The most common symptoms for North Macedonia are 2/3 of fever, 40% roughly fatigue, and cough. 1/4 of everyone is asymptomatic, and 1% have been pregnant women. Our fatality rate is around 4.2%, and we have an overall positivity rate. If we look from the beginning on the 26th of February all the way till the 23rd of August, we have a positivity rate of 9.9%, which right now, as we said, is on the decline. So let's see what schools around the world have done. Here's the US, and you can see, let me just remind you, we had roughly 660. They have a 1,700 per 100,000, and they have 98 per 100,000 in the last 7 days daily cases. So obviously, they are in a worst case scenario, and some places are reopening schools and some are not. Finland, a much better situation than us. They're opening schools, and they've opened schools on the 19th of August. Israel, for example, is in a worse situation than we are, and they're opening schools on the 1st of September. And remember that very famous case on May of the spread of the disease. One of the reasons that had happened, there was an outbreak, is because there was a heat wave in Israel, because this was in May, and air conditioning were turned on, windows were closed, and masks were removed. South Korea, we see where they are compared to us. And Great Britain was probably the closest to us in the numbers here that I've presented. And yes, UK students are expected to be back in school. But let me tell you, no place has the utmost confidence in the way they open, and parents and governments are very hesitant on next steps. So the debate is still out there. And as we see today in the media, there's parents for, there's parents against. The government now, our local government, is reconsidering certain decisions that they've made. So the discussion will probably be ongoing. I believe ongoing until this pandemic is over. So let's look at the parent survey results. Let's see what you told us the first time around and what you told us the second time around. So the first time, around 30% of people were hesitant to come for a variety of reasons. And now we see a almost 9% improvement. And we believe it's because of our reopening plan and the way we've communicated in terms of how we're going to run school. We're very happy to say that the second survey captured 667 students, or 86% of the student body. So therefore, we believe these numbers to be very representatives. And we like the trend and the encouragement of parents to reopen the school. But we have to say, that is only one aspect to the decision that we make. We just presented the epidemiological aspect. We also presented our physical security and health protocols. Another important one is our staff. And our staff has been a little bit more hesitant because they are more at risk than children. And so we have a third of our faculty that would prefer the distance over the blended. And this has to be taken into effect. Let me be very honest. Today's decision to delay school reopening to October 1st makes life more difficult for us as well, because we're not an isolated island. Many of our staff members have children in public schools. That makes running the blended learning progressively more difficult as we go along. Should they not reverse this decision, it's also going to be very difficult to do it for the foreseeable future, because our faith, unfortunately, is linked to the whole community. What we've been able to do is encourage our staff, and really we've now have generally 95% of the faculty, although some would prefer distance, that they're ready to come on campus, and we've made accommodations for certain staff who is unwilling or unable to come. And let me tell you, that has not been easy, because there's substituting teachers or making other arrangement has been a very hard and arduous process. So official approval by the government. We sat in on the meeting of the Commission on Infectious Diseases on the 10th of August. We presented our reopening plan, which was also translated. We're happy to see that many aspects of our reopening plan have also been embedded into the government's plan. We then submitted an official request after their positive opinion on the 18th of August, and on the 20th, we received the approval. So that means we can make an independent decision. And if you read today's media, yes, the recommendation is that schools open until grade 3, but because we satisfy certain preconditions, we can make our own independent decision, which doesn't mean that necessarily we will open up the whole school, but we can make this decision differently than what the government decides. Although we realize that the best way is for all schools to make the same decision, as this also simplifies decision-making for us as a school. So, provided the current epidemiological situation, the government's decision, and our own school preparedness, including the surveys and the physical features we put in place and the protocols, this is the way we will commence the school year for early education center and elementary school under the blended learning model, and secondary under the distance learning. We will have a 2-week revision cycle. We will be adding more grades should the conditions improve, and reverse course if they worsen. And so right now we're almost at the 8-hour mark. So we are now approaching the second portion of our meeting. I will hand it over now to Daniel, our assistant secondary principal. He will actually respond to some frequently asked questions, but also open the floor. And I can see that you've asked many good questions in the chat as well. So although we probably will not get to all of them, we will try to make sure that we get to most of them. And different people from the CMT will be responding to different questions. So I thank you for your patience, and I'm here available to answer some of your questions as well. So I will stop sharing now. Or do you want me, Daniel, to leave it? Okay.
Please do, yeah.
So what I'll do is.
Okay, I'll start off. Good evening, everyone. I'm going to, as Yvonne has shared, go through a pre-selected range of questions, all of which have been drawn from questions you have given us through the second parent survey. At the end of these pre-selected questions, we are going to start pulling from the questions in the chat. So if you haven't had a chance to ask your question yet, please do post it there, because the rest of the CMT, the crisis management team, is pulling those questions and ordering them and preparing a response at the end of this section. So we hope to get to all these questions if we can. All right, so one of the questions that appeared in the parent survey and which repeated itself several times was a concern with what happens if upon return to face-to-face learning, whether through blended or in some incredible future, if we move to Model 1, what happens if you want to return your child to home because the measures that are in place are making it difficult for your child to learn or are presenting physical or emotional problems? Now, what we want to say unequivocally is that under a Model 2 reopening, a blended reopening, we understand entirely if the decision of a family is to retract their child from classes and pursue a fully distance option. And so what that means is our faculty and our admin team are prepared to support the duality of having students on campus and having students at home following along to the curriculum. Take the next slide. Even if you wouldn't mind going to the, thank you. Another common concern is coming from parents who have carefully read the reopening plan and are thinking about what the blended schedule means in terms of the shifts that have been presented, because there's concern that if you have multiple children in the secondary school, that they might be asked to come on alternating days, creating greater burden for you in terms of finding adequate care for them on days when they are not at the school. So what we're committing to is to the best of our abilities, which is sufficient for this, that all siblings will be placed in the same shift. And so we are intent on ensuring that there's convenience and harmonized scheduling for families. Even if you wouldn't mind. Thank you. So another question that emerged was, do you have a protocol if or how the classes will continue if it turns out that some kids or teachers that were attending classes were COVID-19 positive? Is it possible to organize initial testing of all children and staff at the start of the year? Now, this is a question that appeals to the conservative side of our reopening plan. And the answer to that is that students and staff and or cohorts or affected classes members will be sent home to self-quarantine for 14 days and receive PCR testing to rule out infection. Contact tracing will commence on our end, conducted by the Health and Safety Committee. All classroom spaces, shared areas, and other possible areas of contact will be thoroughly cleaned and disinfected using the methods that have been outlined in this presentation. All staff who share a workspace in the case of the infection has occurred at home at the school will be sent home and will be self-isolating and conducting a PCR test before return to campus. However, in the case of multiple infections on campus, the school will make a decision with regards to school closure in accordance with the risk assessment matrix, which we have shared. Thank you. So in the event of a transition to Model 3 from Model 3 to Model 2, will the homeschooling group attend online all of the classes from their schedule, or will they just be briefed and given homework or projects as they were last year? If children remain home, it'll be our intention that we provide a variety of online engagements. Teachers may be able to provide some independent learning dependent on the curriculum and their teaching schedule, but in practice, it would not be possible to run a fully equivalent face-to-face and full distance program when we're committed to Model 2. Now, that being said, there is energy being directed right now towards ensuring that we can provide some consistency in the form of access to the classroom synchronously as faculty are teaching, so that students who are electing the distance option under blended might have some access via a webcam, or as we pursue options, some more exciting and effective solutions. So our goal is to provide the best experience possible, even for fully distanced students in the event of a Model 2 opening, and we'll be pursuing every option we can to make that possible. So another question that's emerged has to do with newcomers to the school and how it is that we're accounting for this unique experience of both the pandemic and arriving for the first time. And so for that, our answer is very much the orientation and the weeks that will follow the orientation, which will be focused on having the students get to know their teachers, their peers, the learning systems that they're going to be asked to master, and essentially to come to a place of comfort before we move on to really get started in the academic year. And so what that means is, if you're a newcomer to the school and you have concerns, please know that we are setting this year up so that you are able to acclimatize, and your kids are able to acclimatize without the stress of having to hit the ground running. And our orientation plan assures that we'll have no success, I hope, in that regard. Now, we've also been asked if the school has considered random pool testing of students to monitor asymptomatic cases, and this is in line with recommendations made elsewhere, especially in environments where pools of students can be pulled out and tested to assure that there aren't cases sneaking in that we're not catching because they're asymptomatic. But at the moment, we're committed to focus on testing our staff. We've just committed to a full testing round, and we've managed to test everyone who works at the school in advance of the opening. In the case of local school transmission, which warrants a school closure, we'll be retesting all of our staff, but we'll be asking that families obtain a negative PCR test before returning their child to school. Question that emerged has to do with the blended model opted for in the elementary school regarding the shortened day and office hours happening in the afternoon. And the answer to that has to do with evidence which has emerged, which suggests that the duration of exposure is quite an important variable. And so we're committing to, in our commitment to follow the evidence as it emerges to make sure that our response is as appropriate as it can be, we decided to make amendments so that we can ensure that there isn't greater risk than there needs to be, while still providing the best experience possible. So this is the question which we received a lot, and we were very grateful to receive it. And that is, how can we as parents help to make sure that our child is safe? And I think this question bears repeating many, many times, and that is that public health and the health of our community is all of our responsibility. And the CMT believes that for our reopening to be effective, we're going to have to rely on everyone, all of us, committing to follow the plan, monitoring our own health for symptoms, self-isolating if you think or if you suspect you've come into contact with someone who was infected, because only through a cohesive and joint response by everyone is reopening even possible under these circumstances. Okay. So at this point, we're going to refer to some questions refer to questions that were given in the chat. So I'm going to identify the question and ask for an answer to be brought. I'll read the question out and I'll tell you who's going to be asked to respond to it. So this is one that appeared several times. I think it was answered in the chat already. It's going to go to Bella, if you wouldn't mind answering this one. My daughter is a new 9th grade student this year. Does she need any school issued equipment to start online classes?
At present, no. So all the information that 9th grader, whether they're a new 9th grader to the NOVA community or whether they're transitioning from the middle school. So it's important that they're with us during orientation days. If they cannot be physically with us on campus, there will be a virtual component so that they will get the same information. they would need a laptop. As you know, it is the key ingredient. All of their materials will be available electronically, including textbooks if there is in fact a class that uses a textbook.
Thank you, Bella. Okay, so I'm going to go to this following question, which I will ask Ivan to answer this when I finish reading it. Why did you decide to extend the scope of classes for blending learning to the 5th grade while public schools will go until the 3rd grade? Do you have a tolerance threshold set for closing the school?
We know that in 7 months of the pandemic, not much is known. So we tried to use the best practices of other schools. We looked at the World Health Organization and the Center for Disease Control. We looked at recommendations of how school reopening should happen. Why up to grade 5? Because up to grade 5, the setup for learning is very different than from grade 6 onwards. They have their homeroom teachers and they have few specialty teachers. It is effectively the division in which it's the easiest to maintain a bubble. So this is the logic behind why we initially opened from pre-K 3 to grade 5. It also is part of some of the recommendations for reopening because our setup is very similar to the American or the UK system in that sense. And it just common sense. Having said that, we're looking to increase the grade levels as we go along. It doesn't mean that automatically over 2 weeks we will add another grade level. It'll depend on a lot of conditions. But the goal is that ultimately at some point, when the conditions are right, and when we say conditions, we judge based on all these aspects. And by the way, we're all going to be having differing opinions. Even in our group, we don't all agree about how we should do this. We're going to have differing opinions, but we will collaboratively decide whether to proceed with adding other grade levels or stay where we are or potentially even reverse. And as I said, we will always be driven by a conservative opinion, not by popular votes, not by the insistence of several parents. We will drive the process forward based on conservative estimates. And also it's important to note that we believe that in every different model, whether it be normal, whether it's distance or blended, we will do a good job. So our school reopening is not one setup, it's all three. And therefore we believe that we will provide an equal level of service in all models. And we've worked very hard to prepare for it. It's not just putting a thermal camera, it's about preparing the academic aspect of it. So in that sense, although we will listen, have an open mind to suggestions and everything else, we will ultimately have to make the decisions as a school, as a CMT, looking at all facts and data, including your opinion. And at the moment, that opinion is that we believe that the grade 5 is the cohort that we can open, irresponsive of what some might think or might not. And by the way, we're seeing, we have both sides on the fence about how this should happen. So we will soon find out how well this decision has been thought through and how well we will be able to actually execute it. But mind you, we're only going to be as effective in doing so if we have your support and collaboration. We're in this together. It's not one side against the other. So therefore, if we work together, I believe we will succeed in that we will have, at one point or another, all students on campus.
Okay. Another question we received was with regard to siblings coming to campus and ensuring that they are kept together. And the question was specifically asking whether or not these siblings could be kept in the same class to minimize the risk of transmission. As was mentioned previously in the presentation, commitments are being made to ensure that the shift at which your child comes to the school, your children come to school is the same and it's harmonious, so that you can send all of your children to school on the same days and have them home on the same days under the blended model for the secondary school. Now, a question referring to keeping these students within the same class is something that we could pursue further. And these sorts of individual questions with regards to schedules are something that we would be open to hearing under the best of days, not just under COVID times. And so please do write to the secondary school admin and myself, and we will pursue that request further, definitely. Now, another question which emerged I think, so this regards to the government decision announcing that schools will be open. I think this question has been answered. I apologize. All right, I'll go with this one. Okay, question was, what is the ultimate strategy of the school in the current situation? To wait for some good health conditions, which will not happen in a few years, or to make efforts to create conditions for teaching with acceptable risks? So this is a question concerning, I assume, the secondary school and its strategy for assessing when conditions are good enough to reopen. We've committed to a regular review every 2 weeks to look at the situation. But I think I'd just like to ask Elon as well to pop in here, but to say that we are looking for the safest possible condition at which we can balance the need to bring students in to give them the experience that they deserve and that we want to give them, with all reasonable safety precautions put in place.
So there's two aspects. One is in terms of the health and safety. No matter what we do, we will only mitigate. We will not eliminate risk, and risk is very real. Although I read a question that said that many countries have reopened successfully and there's no cases. Yes, this is correct in places where the incidence rate is considerably lower than in Macedonia. At the same time, many places, including the US and the UK, where the cases are high, there's a very high likelihood of spread within the community. I gave you just the probability ratio, so we have to be very honest. I believe, if you personally ask me, now I speak as Ivan instead of as principal or director and the leader of the CMT, I believe there's a high chance that we might see a case the moment we start bringing more students to campus. And to me, it's not a matter of whether we do, but how we treat it. And we believe we're prepared to do this. But at the same time, we're not going to be rushing into a decision which could potentially put any member of our community, and I say every member of our community, to potentially be exposed to something that could be life-threatening for them. Even one case is one case too many. The second part is very important, is that even in distance learning, we're going to have a different distance learning experience this time, as we are not in lockdown like we were from March to June. That means that we will be bringing little learning pods of students on campus. They will have some interaction, far from what we're used to in the normal. And we hope maybe that we reach the normal in the second semester of the school year. But right now, we're going to give them some exposure. So in that sense, this distance learning will not look the same as it did from March to June. We had to sit home because we didn't know what we were dealing with. Now we have considerably more information and we're better prepared to tackle it. That's why today we're talking about bringing students to campus. If this were 6 months ago, we'd probably still be talking about lockdown and not having anyone on campus.
Okay. Another question that's emerged is the following. Is it possible for you to reconsider the mask usage policy so that masks should also be worn during breaks and when outside, especially for smaller students who can easily forget to keep a safe distance? I'm going to ask that Mr. Listovsky take this question.
Then can you please repeat it one more time, because I...
Sure thing. The question's about the mask usage policy and whether we would reconsider a policy such that it makes it so that children, especially smaller children, would wear it outside during breaks and whenever outside.
I remember we decided to go conservative on this and to stick to this rule for the first 2 weeks, and then reassess it and review it, and then decide if the kids should not be wearing their mask while outside and while keeping the distance. So for the time being, we are going to stick to our decision for kids to wear masks whenever they're outside of the classroom and in the classroom, except for when they have their lunch. That's it. And there was a question about the issue of kids wearing masks during the PE and dance classes. They will have to wear it on their way to the gym or outside when they're not doing the physical activity. During the physical activity, except for the times when the teachers will make a judgment, or they will assess the situation that there is plenty of physical distancing between the kids, and then the kids can remove their mask, but only outside.
Let me just add, we looked at the latest World Health Organization study, which says that kids from ages 12 and above, and I already said this, should wear masks at all times. For kids younger than that, they shouldn't wear masks, except when considered in risky environments. Unfortunately, classrooms are considered risky environments, and there they lowered the age to age 6, from age 6 and above. So we're going with that recommendation, as are all CISA schools and many other national schools. So ages 3, 4, and 5, no masks when instructed by the instructor. And from ages 6 and above, we're actually going with masks. Please mind that our reopening plan, as I said, only predicts what happens in the first couple of months. And we're subjecting things to change. As I mentioned, we're changing the library policy now as we realize maybe there's a better way of doing it and new data emerges. So this is a document subject to change. But mind you, we are starting very conservatively because I think we owe that to ourselves. We owe that to the rest of our community.
Okay. Ivan, there's one more question that I think you'd be a great to answer, which is as to the structure of the CMT and the role of parents within the CMT, and more importantly, whether we would consider increasing parental participation in the decision-making process in the upcoming period.
So first of all, it's a great question, and one that we should have placed. As a part of the government's permission for reopening, we are required to regularly inform all of our constituents of all of our decisions. We therefore are going to do something that we will call the crisis management team, the CMT Plus, and for certain aspects of a meeting, we will include parent memberships to the team, so we can also have their feedback. Understanding that not all parents will be able to represent all the different views, but we're going to do this, and we're going to take it under advisement. So we vote as a team. So the 13 of us actually have voting rights in the reopening decision. So our parents will not be voting members, but they will have an opportunity to advise the school as we make decisions. So I think it's a very good question, and yes, we will have an opportunity for more parents to partake.
Okay, thank you. Another question has emerged regarding the situation for IBDP students. And so I'm going to ask Bella to address this question. What can all of us do to help this transition go smoothly and the changes come easier for the kids under these circumstances, especially for the grade 11 and 12 students who are getting ready to start their next phase in life, university?
It's a great question, and thank you for asking it. We have a great team that is in the DP led by our IB coordinator, Ms. Erastarova Tahir, and she will continue to invite parents for different webinars and sessions as more information is being rolled out. We do have some clarity on the structure of the May 2021-2022 exams. But as past practices have taught us, there's still a great deal of things in flux. So we do know that the IBO has taken into account that not all schools will have the same contact hours to ensure that the prescribed curriculum, which they are meaning to have students cover in different subject area groups, is in fact covered. So they have reduced a number of the exam components. So our first meeting with Ms. Starova will be about those changes, and it will come in early September. We want to give the IBO a little bit more time because they tend to publish a lot of new information at the beginning of September. So when we hold the parental sessions, we want to make sure that they are for the particular grade level. Now, having said that, last year we started using ManageBack, or learning management software, which is the #1 learning management software for IBO world schools everywhere. And we started using it for the DP core, so for TOK Extended Essay and CAS. But this year we're using it for all of our MYP classes, so everything 6 through 10. And we're using it for our IB classes in 11 and 12. So you will have a very clear understanding in terms of the assessment, how students are getting ready for the assessment, and also what the calendar expectations are, because the DP has very specific internal deadlines which are non-negotiable. Now, I want to assure you that with great responsibility also comes a need for collaboration. So we will be continuously reaching out to the parents community, not just to make you aware, but also to ask for your support, because in order for students to be supported in achieving their best through these very turbulent times, you also need to be aware of what needs to take place at the home front. We are going to be exploring Wednesdays to make sure that they do lab work, that they have enough practice time for their language acquisition courses, that they're able to meet with their extended essay mentors. So all of that has been factored in. But the DP is a rigorous program, and it does require for students to do a little bit of growing up, and we hope to have your support in that.
This next question concerns orientation, specifically for grade 9. Alexander, could I ask you to answer this one? The question concerns
Yes.
whether or not students will have a chance to meet with their grade level teachers, or their subject teachers rather, and to uncover or discover what it is they're going to be learning in the upcoming year.
So the orientation for the 9th grade students will be taking place on Monday from 9 to 11. And during those 2 hours, students will have a chance to see and meet all their teachers, but they will not have time to learn specifics about the subjects. And they will do that during the first synchronous online classes starting from Thursday. So we have many things we want to present to the students during the orientation. And given the amount of 2 hours, having teachers explain more about their classes will not be possible. Thanks, Dan.
Thank you. I'd like to just add my own 2 cents in there, if that's okay, Alexander. And it's that for the advisory, for the orientation that's planned, the role that's going to have a lot of importance there are grade level advisory teachers. We want students who are coming in to be able to know who can help them and to feel at ease before we get into the academic year, because we've decided that we believe that it's very important that we address what might be a very stressful year, promises to be a stressful year for students, by making them as comfortable as possible and acclimatizing them to the school and the people who work at the school who are there to help them before we begin talking about curricula. This next question concerns the waiver at the end of the reopening plan. I think, Ivan, if you wouldn't mind taking this one. Do you think that by requesting parents to sign the waiver, you actually raise doubts about the correctness of the decision to open the school? This bearing in mind that we are left with very little options for keeping kids at home.
I would first suggest that the waiver, that you read the content of the waiver. We want to do with, and it's not a waiver. It is pretty much a form of the students, staffs, and parents' commitment to the safe environment in which their children will be learning. It means that we ask for the reopening plan to be studied. We ask that to be respected. We ask that everyone understands that there's a risk involved of sending your child to school. It's just not possible to eliminate this risk. But, and we realize that we're going to do to the best of our ability to control factors, but we can't control everything. So in that sense, when someone makes a decision, it has to be a mindful one. And that form is intended to have a parent go through that exercise. And after that exercise, if they're not comfortable, they should keep their child at home and go under the distance learning model. And if they're comfortable, they should send them to school. And this is a decision that probably parents will be revising as they go along, because we realize it's not an easy one. But the form is there to have them think about the decision they're making, because unfortunately, now that decision is not without risks.
Okay, so the next question concerns the reopening of the school, or rather the decision not to reopen the secondary school at this moment. This is a Google translation, so please forgive me if I'm not capturing the essence of the question, but it goes as follows. There are many direct, essential questions that you do not answer. Your presentation is clear, but this is a very difficult situation that requires bold steps. Good health conditions will not be created for a long time, and we have nothing worse, especially in the environment that prevails in Nova, compared to many other countries where teaching is held in much worse conditions. So what is the difference between distance learning and blended learning? Sorry, I think I reached the end there. What is learning, especially in the environment that prevails in Nova, compared to many other countries where teaching is being held in much worse conditions? I think, Ivan, if you wouldn't mind taking this one.
Thank you, Daniel. We can compare ourselves to the schools that are like us. I mean, we can't look at every single school in every single country. So for us, the cohort that we work with is the CISA schools. And I meet on a regular basis with the directors. I also meet with the managers, and we discuss. And we've discussed over the summer, we discussed since March of different reopening plans. So we are following closely the approaches of international schools that are like us. In that sense, we're very much aligned with the approaches of other schools. And we believe that's the right approach, because we serve a very similar subset of students. We serve similar communities in cities that sometimes resemble each other. Now, epidemiologically, unfortunately, Skopje is not that great. Some other countries are great. So international schools in Lithuania and Latvia are opening without anything, even masks. But then again, there are schools in Zagreb and in Belgrade, which are opening very much like us, only a portion, and then revising the plan as they go along. So I have to thank my colleagues who have been instrumental in supporting our reopening plan. So we've shared, we've lamented, we've done everything together to be able to, every single school to be reopened within the format that is allowed within the environment in which it functions. But then again, we can only compare ourselves to the ones that are like us.
Okay, because this question has been asked, I think repeatedly, but only perhaps addressed once. The question regarding the decision to postpone opening public schools to the 1st of October, and really what the CMT's opinion is regarding this decision, and the reason for our persistence with the special allowance that's been made for our reopening by the government of Macedonia.
I mean, I'll take it as well. People can respond to as well, so they're not only hearing by me, but we went through the steps. We went through the approval. We were fortunate to also have a seat at the Commission of Infectious Diseases, so we saw the dynamic when protocols for schools were discussed. I believe we also assisted the process by providing best practices example. We believe that a part of that decision is due to politics as well. I mean, and to the way the governments are formed and the fact that they need to enact laws. We're a private institution, and we can make certain decisions a little bit easier than the public schools can, and we can do them faster. And secondly, we spent the better part of the summer working very hard on these protocols. So we worked knowing that we wanted to be prepared to reopen in all three scenarios. So we were focused on this. Public schools require a little bit more time to get there, and we're going to support them through this process. We're all in this together. There was, I think, a suggestion that they might open 15th of September. They've now extended it to October 1st. I think it's a good decision in light of the situation there. It's going to allow them to prepare better for the online learning, and also for the blended learning for students that come on campus up to grade 3. But we believe that in some ways we can make a decision independently. Although, as I said previously, I wish they had made the decision to start earlier, because delaying the decision makes it also difficult for some of our staff who have kids in public schools, and that will also make our operations a little bit more difficult, because in terms of childcare, and other issues that might arise as a result.
Okay, we have reached the slated end time for this presentation and town hall.
But there's a beautiful statement at the end that you might read by a parent. I think it encapsulates.
Oh, something new has come down. Okay. From Ms. Dineska, thank you for the presentation. Every single one of us is responsible for the well-being of the entire school community. So I hope all of us will follow the protocols at school as well as at home. I wish everyone a healthy school year. I could not have put that better myself as a way to end this meeting. Thank you very much. So I will just say that we are going to be responsive to any questions, any and all questions that we get and that come our way. If you didn't get a chance to get your question answered here, please do reach out to division principals, admin staff, and we will do what we can to address all of your concerns so that we can go into this new year feeling confident that the decision we've made is the best one available to us under these circumstances and ready to reassess as necessary.
Please be patient as well with us because this is also a new experience. We're learning and growing as we go along. I think we will get there, but we also need time. And so if maybe we don't respond to your questions immediately, it means that we're also busy and focused on the ensuing task of reopening the school come August 31st. I think we're there. We are eagerly anticipating. It's been 6 months in the making. No school is a school without its students. So we hope that at some point or another, we will see everyone walk through that door and spend some time at school. And we also are very optimistic that at some point we will return to normality, but also having learned and grown from this experience. We as individuals, we as a community, and I think there's a silver lining in all of this. I'm still looking for it. I know you are as well, but I think hopefully we will be better for the experiences we've just gone through. So thank you very much, everyone.
Good night, everyone.
Good night.